Pros and Cons by Dr. Anirudh Agarwal. And of late, what we are seeing, there is a huge number of colleges and MDS seats are also increasing. So there are a lot of postgraduate students, and जो भी नए clinics open हो रही हैं, mostly those are opened by postgraduate students, especially in this urban area. And what is the main common thing is when you are doing your specialization, when you are in your PD, whether it is endo, pedo, ortho, or is it surgery, so you develop not only you develop some skills in your specialization, but you develop a bit of interest also. You feel more confident in those kind of specific treatments. You feel more confident about it. You feel more connecting, and above all, you feel happy while you are performing this. And after your graduation and during it also, अगर visiting आप जा रहे हैं, so you get a chance to practice your specialization only, and you are doing experimentations with your work. But when you are opening your own clinic, at that time a doctor is in dilemma that he should practice his specialization only or he should do general practice. जिस भी तरह का पेशेंट आ रहा है उसे उससे कैटर करना है या वो उनको वापस भेजे. So this is a big dilemma, and to clear this dilemma, we have Dr. Anirudh Agarwal with us. Dr. Anirudh Agarwal is a practicing orthodontist, and if I talk about his academic qualifications, sir is MDS in orthodontics from GDC Trivandrum. Sir has done his M.Orth from Royal College of Surgeons, Edinburgh, UK. Sir has done his PhD. Sir has a fellowship in orthodontics from University of Australia. He has 18 years of academic career in colleges in Rajasthan. He's practicing exclusive orthodontics from the year 2000. 22 years back, he took this decision. And his clinic name is also Only Braces. Right now, he is one of the top Invisalign providers in India. And I would like to invite Dr. Anirudh Agarwal and would like to know how was he able to take this decision 22 years back, which looks impossible as on date also. Is it really viable to practice your specialization? And what are pros and cons? Please share with your young friends. So, Dr. Anirudh Agarwal, I will request you.
Ankit, the video is not disabled. You have to disable me.
I have. Yes, yeah. Sir, you are visible.
Yeah. Good afternoon, everybody. Thank you, Ankit, for your warm introduction. And I would like to thank Ayushi Density and Ankit for inviting me today to share my views and share my point of view across with all of you today and connect with you all. Like, I've been practicing exclusive orthodontics for 22 years now, and I'm still asked this question that how do you manage? What made you decide this? Are you happy doing this? Are you not? Is it really possible to stick to your specialty practice? Well, let me share my journey with you all. Now, I would say two things come to my mind. First is magical and exciting. My journey was magical because I could do what I wanted to do 22 years back. 22 years have just flown, like a blink of an eye. I don't know when these 22 years passed. I started practicing in 2000 and today is 2022. But when I look back, I'm happy that when I dreamt of being an orthodontist and just doing orthodontics, I'm able to stick on to my specialization. So that is like a dream come true for me. That's why it's been magical. The other side has been pretty exciting. It was like a roller coaster ride. I had my ups and downs, like we all have, in all different spheres of life. Whether you're an orthodontist, you could be an endodontist, you could be a cardiologist, we all have ups and downs in life, right? I had challenges which I had to face. We all face challenges every day. I mean, this is my story, which might differ person to person. The two challenges which I had, when I started my practice was, firstly, if you see my background, my dad was an Indian Air Force pilot. I kept getting transferred all over India. I never stayed in one place. I was never educated in Jaipur. I had no friends here. I had no relatives here. I had only my grandparents here. And no one knew me here. To come into a place and starting from scratch without anyone knowing you was a big challenge for me. The doctors did not know me here. They didn't even know whether I could even, straighten teeth. That was the kind of mindset they all had that time. The second challenge I had, I was very clear from my third year. Orthodontics was what I wanted to do for the rest of my life. I want to, I saw people getting transformed so drastically. I could see the confidence change in them. I could see them look so pretty and beautiful. I could see a whole change in body language and everything. That was very exciting and thrilling for me when I was a third year student. And I decided if I have to practice dentistry, I am going to be an orthodontist. I worked hard for it. I wrote my all exams. That time, I didn't even have private college, nor did I come from a background, where my parents would afford me to send me to a private college. So I worked hard. I cleared my all exams. I came second in all India, and I went to do my post-graduation. I studied for my all exam during my internship. I never, worked in a clinic like most of my friends were doing because I was determined to become an orthodontist. So that was a dream for me, and I stuck onto my dream. I didn't get distracted. I had my ups and downs, but I was very clear. Ortho is what I want to do. This is what I made. And I stuck onto it. I was determined, I was dedicated, I was focused. So that's been my journey. I had my challenges. People laughed at me that time. Patients, doctors. The doctors used to tell me, Doctor, aapko daant nikalna nahi aata, aap daant kaise seedhe karoge? That was a very common question that time. Senior doctors told me, Anirudh, this is not Bombay or Delhi. No, this is Jaipur. You have to do everything. I'm like, no, doc. If I cannot practice ortho, I'd rather, change my profession, get into something else. I will not do other things which I'm not trained to do, which I have no idea about. So I had the determination in me. Patients laughed at me. Doctor, aapko daant nikalna nahi aata? Aapko safai karna nahi aata? When I started my practice, first 2 months, I had no patients. I was just saying no to all the patients because they wanted scaling, they wanted fillings. I never had an ortho consultation. So I just kept sitting, kept saying no, 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 no. And I knew a day would come when I would start one patient, and that one patient would get me another patient, and the cycle will go on. After 2 months, I got my first patient, ortho patient. I waited for a month that I could, recall the patient for his activation because ortho patients visit only once a month. So that was exciting for me. Although, 28 days, I just sat in my clinic without doing anything. But the ball started rolling. And today here I am. I'm very happy, very content with my life. I see myself very happy and content professionally, personally, in all spheres of life. I don't have any regrets for what decision I made because my goal was very clear. I was very focused. I was very determined to reach my dream. I worked very hard for it. I mean, people think it's very easy, practicing ortho. I know how difficult it was. I really struggled to prove myself to people here that yes, I can do ortho because no one knew me here, right? So for them, I was a stranger. So they always had the doubts on me. So when I started getting one case, a referral case, I got them good results. They started trusting me. And then I started getting more references from my patients and from doctors. And that's where, I grew to this stage today where I even stopped doing braces for the last 4 years. I have switched my practice completely to Invisalign because Invisalign gives me flexibility of doing whatever I want. I get better treatment outcomes. I get better results and a lot of factors. So I have not only stopped doing braces now, I have even, specialized my practice even further. I have gone to plastic from braces now. So that's the future. We have to be open-minded to accept, absorb whatever is there in the market, what our patients demand, and whatever more advanced technology we can face to be, open-minded to accept it. And that is so I think Ankit, am I audible?
Yes, sir. Yes, sir. Your voice was breaking. But, sir, my question is, as you mentioned that you don't have any regret today, but was there any phase in between your practice after a year or after 5 years that you feel कि should I do? मतलब मुझे लगता है कि मुझे सब कुछ practice करनी चाहिए. Was my decision was right or wrong? In between ऐसा कोई phase था?
No, I never had this feeling ever because I was very clear from day one. Ortho is what I want to do, and I never saw anything else apart from ortho. So even if I had a patient who required root canal, I would only see the teeth, how they were malaligned, and how the smile was bad. So my focus was very clear from day one. I never got distracted. And if I have to go back 22 years again, I would still do the same procedure again. I would not change my decision at all.
That's great, sir. That's great. And as you mentioned about reference, that first patient came and then he only came after a month and they give you reference. But
after 2 months, I had my first patient who came after.
Yes, sir. My question is ki, when you are not doing any other treatment, like scaling and RCT and any other treatment, So don't you feel this sabotage your reference base a bit if you have patients for scaling, if you have patient for RCT, so their contacts will come you for orthodontic treatment also. You have very niche of references from patient side because of specialization practice.
So there are two reasons for it. Firstly, I never wanted to do general practice. I was very clear about that. कि जो मुझे काम नहीं आता वो मैं नहीं करना चाहता. Firstly. Secondly, I have such a good bond with my patients that even who I did ortho 10 years back will still call me up and ask me, doctor, where do I get my implant done from? Where do I go for extractions? They are still connected with me because the kind of bond and the relationship I have. They will still call me up and ask me where to go further ahead.
Okay, sir. And sir, इसी में मतलब I want to ask one thing more. मतलब when you are doing only ortho practice, there is no any other treatment you are doing at your clinic. So your doctor, the doctor nearby you, do they feel more secure to share, मतलब send their patient to you?
I think that question should be directed to doctors around me rather than asking me. Because they will tell you better, are they secure or are they insecure. As far as I'm concerned, I think the patients going back to them, they should be secure about it. But again, if the doctor's mindset, what they feel, I think they should be better positioned to answer that question to you.
Agree to that, sir. Agree to that. So, sir, मतलब as you shared, when you tell your patient that मतलब you won't do tooth extraction और आप कहते थे कि मुझे निकालना ही नहीं आता, तो how does patient take that? And मतलब if you advise, मतलब if somebody is planning to do a specialization practice and they also have to say this to patient, and not in only in ortho, even in for endo and for oral surgery, if a doctor say to the patient कि कोई और डॉक्टर आएंगे आपका ट्रीटमेंट करने के लिए, तो पेशेंट के बड़े से अजीब से लुक्स होते हैं. सो हाउ टू हैंडल दैट? एंड मतलब आप खुद का माइंडसेट कैसा होना चाहिए इन चीजों के लिए?
See, when I started practice 22 years back in Jaipur, there were hardly any specialists. There were very few doctors who were MDs in Jaipur. It was a challenge that time, but I think with
Sorry for this, student. I think the connectivity has an issue. I will just.
I'm saying like when I started 22 years back, it was a challenge.
Yes, sir.
It was a challenge for me that time. I don't do extractions. But now with the number of MDs increasing in our city, people are getting more and more aware. People do understand who endodontist is. They understand who a prosthodontist is. So I don't think it's a challenge anymore. It is how you educate your patient and how you want to do it. Because you can only master one technique. You can, develop skills for a particular thing. You cannot do everything. That's my point of view again. People might differ on that. But I personally feel that you should master one technique and go for it. And patients do understand. But now with times changing, with so much of digital marketing, digital media, and so many MDs around in Jaipur, I don't think it's a problem anymore now. People definitely understand and they appreciate it.
That's very much right, sir. And when you say ki master one technique, in that case scenario, do you think if you are doing a specialization practice, you are able to focus more, you are able to experiment more, you are able to learn more, and you can excel to a great extent when you are doing only one treatment? Is it so?
Again, Ankit, it's very controversial. This is my personal point of view. I personally feel if I can do one thing, I should do it perfectly. That's my point of view. But if people can do multitasking and they can do everything together and they're happy with it, I think they're doing a good job. For me, I think doing one thing and be more focused with it and learning, evolving it over a period of time is what works best for me. But everyone has a different point of view and they all are right in their own way of dealing with their own practices. Because your practice will develop the way you develop it. If you decide to do something, आपकी practice अपना वैसे develop होती जाती है, right? It is nothing that you have to make an effort. That's it. But once you start, everything becomes automatic after a certain amount of time. So if you decide to do the specialized practice today also, yes, very much you can do it. When I could do it 22 years back, why cannot someone do it today?
Okay, sir. And do you think this helps you for a better work-life balance also? Matlab you get when you are doing specialization,
yes,
you have
definitely.
time for
One of the reason why I became an orthodontist was I did not want to work more than 2 hours in my clinic. So I have worked all my life. 2-3 hours is the maximum time I worked in my clinic because I have a lot of things also to do in my life, right? So I don't want to compromise my personal life, my social life, just for my work. So I have balanced everything, and I'm not doing everything. I don't have emergencies in being an orthodontist. I don't get patients calling up. I have a pain. I have teeth which are causing extreme pain. I need to visit you right now. There are no emergencies like that. So I have a very easy life. I'm able to balance my work and my social and personal life.
That's
so I'm
great,
very
sir.
content. Whatever decision I took 22 years back. Yeah. Again, it is very personalized as far as I'm concerned, but everyone has their own priorities in life. Everyone has their own way of working, and they have their own requirements. Like some people are more happy working, so they are, enjoying it. But for me, my work is my enjoyment, but I cannot work more than 3 hours. That's my limit. If it's become more than 3 hours, then it's a burden for me. So I balance my life with ortho practice like that. So when you're doing specialized practice, you see less number of patients because you're doing limited work. So you have more time to work on those patients. You can get better outcome, and you have more time for your own self.
Definitely, sir. Matlab, when you are doing specialization practice, you have more time to consult your patient. And again, social media is a big thing now, so you have time to work on your social media also. So tell me about your, does it impact your relationship with patient when you doing specialization practice? Is it
Voice
beneficial for
voice
the
is breaking.
relationship? Sir, my question was, is it beneficial for your relationship with patient when you're doing specific practice and you have time to consult with them?
I didn't get you. Can you come again? The voice is breaking.
Yes, sir.
Can
I
you
was
repeat?
saying, is it
Yeah.
beneficial for your and patient relationship that you are doing specific treatments and you have time? Basically, you have time, so you can develop a greater bond with your patient and you can answer
So
more
that
of
again
their queries.
depends. I think it depends on the personality of doctor. I have a very friendly relationship with all my patients, right? So because ortho patients come to us for a long period of time. They come to us for 1 year, 1.5, 2 years also. So when you see them every month, you develop a relationship and you develop a bond with them. So I'm very friendly as a doctor with all my patients, and I have very good bond with them. They enjoy coming to my clinic, and I look forward to them to visit me again.
Okay. So, sir, anything you have advice or a piece of your experience you want to share with your young friends who are in the session and who will watch it afterwards on YouTube or any other social media? If they are thinking, then they are in this dilemma कि specialization perform करना चाहिए या नहीं करना चाहिए. What is your piece of advice as on date and what is the future?
Definitely, I would say that the ones who are getting into practice now should decide what they want in life. What do they see themselves, 20 years down the line? Do they see nothing is right and nothing is wrong? It depends on what you want. I don't say specialized practice is good and non-specialized practice is not good. Everything is fine depending upon whatever you want from your particular practice. So someone who is more into multidisciplinary practice should go for that. And someone who wants to be focused like me, go into specialized practice. So it depends what your vision is, how you see yourself 20 years down the line, and work hard for it. There is no compromises. You have to work no matter what path you choose. You have to work hard. You have to be focused. You will face difficulties a lot of times, not once. Even today, I face difficulties. You have to learn to overcome them by your determination. And life goes on, and your practice will keep developing the way you want to develop. At the end, you need to be happy and content whatever you're doing. All right? If you're enjoying your work, it's fun.
That's okay,
So
sir.
I think you should
And
follow your dreams, and do whatever you see yourself 20 years on the line. Think of it like that.
that's very much okay, sir. And I will request questions from audience if they want to ask anything from Dr. Anirudh, they can type it in the comment box or they can raise hand. We will unmute them. Meanwhile, I will ask my last question to sir. You can post your questions as you want. My last question to you is, sir, how do you maintain your charisma, like your personality and everything? As you said, कि there is only 3 hours you are working. I understand the thing, but how does it helps in your decisions and how it helps you to develop a personality basically this decision?
See, I feel, being a doctor, we are the most educated people in the society. And I think doctors neglect themselves the maximum. Most of the doctors are, overweight. They're not health conscious. They don't exercise. They don't have healthy eating habits. So I think integrating everything and looking after yourself, pampering yourself is very important. You can only do that once you have time for yourself. I do everything I want in life. I gym, I holiday, I party, I spend time with my family. Everything has to be balanced. It is not just about practice.
Thanks, sir. Thanks, sir, for sharing your views. I'm sure this is a thing everyone wants to know, especially when they just complete their PG and they open their clinic and initially they communicate to their patient कि हम तो यही कर रहे हैं दूसरे डॉक्टर से डॉक्टर साहब करेंगे. सर वन मोर थिंग, मतलब जाते जाते एक और क्वेश्चन मैं आपसे पूछ ही लेता हूँ कि मतलब एज यू सेड देयर
Yeah,
वाज नो अदर एनी अदर डेंटिस्ट इन योर फैमिली, मतलब नो, मतलब
yeah,
फादर एंड नीदर योर स्पाउस. So if someone
right.
is from the family of dentist or someone spouse is a dentist, then how come they perform specialization? Because बाकी तो treatment वहाँ पे होंगे ही होंगे.
See, again, that's very personalized, Ankit. I think you should give each other enough space. You know, you need to be in separate clinics. That's the way I look at it, and do your specialized practice. You need to give each other enough space. You cannot have the same environment in the house and the clinic. So I think the best thing is have your own workspace, do what you want in your clinic, and don't discuss clinics once you come back home. So that you can have a happy life. Otherwise, you're discussing your patients and teeth all throughout your life.
Thank you, sir. Thank you. I'm sure this session will be very helpful. And this session will be available on Ayushi Density's Facebook page and Ayushi Density's YouTube channel. We will share Dr. Anirudh Agarwal contact details, his number and his email IDs. And anyone has some questions, they can post it on their email IDs. So once again, I'm very much thankful to you, sir, for taking your time out and sharing your experience with your young friends and our young doctors.
It's been a pleasure. I hope my words would, impact the people who are molding their mind to get into practice so that they know what they want in life. And then they can work towards that goal in mind. So think what you want in life and start working that direction. And be determined, be focused, and be ready to work hard. And you will reach where you want to reach. There's nothing that is impossible in life.
Yes, sir. Yes, sir. Very, very truly said, sir. Very truly said. Thank you, sir.
Thank you.
This audience may leave now. Yeah.
Do we have any
Thank you, sir. We
questions?
are closing the session.
Okay.
We are closing the session.